to share with you and all of the many new members of the DDAC that are joining us for the first time today. And I'd also like to welcome our Vice Chair, Michelle Judah. Michelle?
Hi, good morning, everybody. It's great to be with you today. Looking forward to the work that we'll be able to do during this fiscal year, and just want to say that it's absolutely fantastic to see that we have an American Sign Language interpreter with us today and closed captioning. So thanks to the folks who worked that out.
Thank you. And so I'm going to ask whether we can pull up the slide with the agenda. Thank you so much. So we have now completed the welcome and introduction portion of this morning's meeting. And as was mentioned previously, we have a number of new members to the DDAC that are joining us today for the first time, and we're very excited about that. So welcome to you all. I'd like to now ask Kevin Valencius, who is our Deputy Commissioner for Budget and Finance, Enterprise Solutions. Kevin, are you with us this morning?
Yeah, Roger, I'm here. Good morning. Good morning, everybody.
Good morning. So we now have an enacted budget, which sets the groundwork for this year's fiscal year's activities. So we were hoping that you would walk through a little bit what was in the enacted budget and how that compares to what was in the proposed budget. So with that.
Sure. Yep. Thank you, Roger. Again, good morning, everybody. So appreciate being here to explain to you, really giving you an overview of what's in the budget this year. So I'm going to start with just highlights. I know we have many new people, but some of you have heard my previous briefing. So we'll talk about, the major changes that happened in Enacted, but then also kind of delve into some detail about what the budget, what continued forward from the executive proposal. Just I'm not sure how familiar people are with the budget process, but the governor is required to introduce a balanced executive budget that comes out, in January when it's a non-election year, and that that serves as the basis really for negotiations with the state legislature on the final plan, which is due to be enacted on April 1st. Roger previously discuss the state fiscal year timeline, and we run on an April 1st to March 31st basis each year. So with that said, the enacted budget does provide over $4 billion in state share resources to OPWDD, and this represents an increase of over $70 million from the initial or executive budget proposal. Major highlights of those changes, are in several areas. First and foremost, the enacted budget does provide for a cost of living adjustment, or COLA, and trend. We kind of use those terms interchangeably. And what that really means is that we did receive about $27 million in state shared funding to increase reimbursement levels, both Medicaid rates and contracts, to nonprofit service providers by 1%. The COLA itself will take effect on April 1st, 2021. And it'll run over the course. At this point, the budget only contemplates a COLA for this current fiscal year. I'm going to refer to it as the budget year, but we're now beyond April 1st, so the current year. This was not included in the initial executive recommendation, and therefore this is an add as part of that final budget deliberation. The enacted budget also does provide about $23 million in new cash resources in the current year to avoid what were across the board rate cuts, or across the board cuts to both Medicaid and non-Medicaid programs and services. When we first discussed, some of you will recall, when we discussed the executive proposal, there were two actions that were being advanced or included in that budget because there were two really kind of scenarios. One was the practical scenario of what we were facing in terms of the state financial plan gap. And then we had this kind of ideal scenario of what would happen if the state received, I think it was upwards of $15 billion in federal aid. And so there were two actions that were included in the executive proposal that, would be restored, if you will, if there were sufficient levels of federal funding coming into the state. So those two actions that have been restored, involve Medicaid rates. So at one point there was about a $10.5 million reduction to OPWD's budget that was related to the imposition of a rate cut. That rate cut has been restored, and we will not be taking action to implement the equivalent of a 1% rate cut, which was, the anticipated value at the time. Further, OPWD received $12 million to eliminate the need to reduce spending on certain state-funded programs and activities. You'll recall that the executive budget proposed a 5% cut to non-Medicaid spending, and it's really the same dollars that were subject to a withholding of state funds that was implemented back, I believe, in August of 2020 and has since been restored. So both a 5% potential cut to certain state-only programs and the equivalent of a 1% Medicaid rate cut to those rate rationalized services, meaning services delivered by the nonprofits in the areas of supervised IRAs, supportive IRAs, group DAHAB, ICFs, and Prevoke are not being implemented. They were restored as part of this budget. The budget also restored, funding for care coordination organization rates, or CCOs. The executive did propose a kind of a two-tiered reduction to CCO rates of reimbursement. One was, in essence, an across-the-board reduction relative to anticipated cost, as well as, growth in that service. The other was really a kind of an earn back, if you will, relative to the need to ensure that individuals are enrolled in other federal and benefit programs to reduce Medicaid spending. Both those actions were restored, but I just want to put a little footnote on that one that, as part of the budget, there was a lot of focus on, and conversation was on CCO cost. And consistent with our broader and the largest component of our system spending on those rate rationalized services, which are all cost-based rates, we're going to be assessing the CCO cost reports that are due to us. I think the balance are due June 1st. And, we're going to be really looking at that and other data necessary to make informed decisions about what levels of funding, we'll be supporting for CCOs. So if they come in where the cost reports look like there's, below, our current rates, we'll definitely look to ensure that, payment is made based upon reasonable cost. So just as a clarifying point there, that the monies were restored, but we're still obligated and required to ensure that we're paying, providers at a reasonable cost going forward. The budget does also look to maintain research activities for OPWD. The executive proposal had a recommendation to change the oversight requirements of our research facility, the Institute for Basic Research and Developmental Disabilities, or IBR, which is located on Staten Island, really to have an affiliation with the New York Psychiatric Institute, which is under the auspices of OMH. That action has been rejected, and OPWD did receive about $1 million in fiscal year 22 that we had initially thought would be savings from anticipated staff vacancies prior to that transition to OMH, but the transition won't be happening, and we actually got $1 million back this year to refill those staffing vacancies. Finally, the legislature provided over $1 million in targeted ads to various organizations, typically referred to as legislative ads or member items. I think it was about $1.2 million were made available to about 7 or 8 different organizations specifically, within that have, ties to the OPWD service delivery system. The budget also does look to provide general salary increases for state employees. We're still working on what that really looks like for us. We think it'd be around an $18 million add back for state operations, and this is just for our programs and services that we operate. That action was deferred hopefully you guys can hear me over the beeping. That action was deferred as part of the executive proposal, but was ultimately restored in the enacted budget. The money is just being carried centrally and not with OPWD, I think, just to do a lot more analysis as to who gets, how much. So there's also, before I leave and talk very quickly about, some Article 7 or legislative pieces, there was also recognition in the budget for additional federal funding that I think we're going to talk about in a little bit in terms of the planning process, or enhanced FMAP, federal medical assistance percentages. And that's really the effective rate that we get in Medicaid, to cover the federal share of Medicaid services. And, that historically has been 50% for New York, one of the lowest in the nation. And, where the American Recovery Plan Act of 2021, which is federal legislation, provided for a temporary increase in that FMAP rate, 10% for home and community-based services waivers, services, and that's really a lion's share of our spending. And so what we did is there's appropriation language in our budget that would allow us to quickly begin to make awards if we're able to use these federal funds as a grant-like process, like we did with balancing incentive program funds from several years ago. So we're still waiting federal guidance on what's appropriate and how we can realize and use those resources. But we felt it was very important to ensure that we had the flexibility, really that the commissioner had the flexibility to distribute those funds in accordance with the requirements of that federal law, as quickly as possible. So that's a real good thing, I think, for us. Again, we're just waiting federal guidance on, how those monies can be used, and more importantly, how we'll also be realizing them in New York. The budget did also include a couple Article 7 provisions. We have this authority known as temporary operator, where we have the ability to appoint an operator over certain programs and services where the current provider is not doing so well. And so that authorization was set to expire this year, but this year's budget did allow us to extend that for an additional year. We also have some broad definitions with respect to telehealth. It expanded definitions in the public health law to remove barriers to receiving telehealth services from providers throughout the United States, regardless of their physical location. So a couple legal changes that were included in the budget process as well. Now, since I didn't have an opportunity to talk to most of you, earlier on, there are some actions that are still, contained within the executive budget that made it into the final proposal. So I'll start off, with some of the overall additions. OPWD, has for the last 8 years received resources to support new and expanded services for OPWD eligible individuals and their families. And the resources really are intended to support the full array of our service, our continuum of supports and services, including residential, respite, day have employment, and other supports. So those funds are included in the enacted budget. Included in the enacted budget as well are, new monies to continue to support the transition to a $15 per hour minimum wage for staff in our nonprofit sector. There's a new investment of $32 million in state resources that when you really look at the investment over the last several years, would leverage a total of nearly $270 million when you include the federal share of Medicaid to annualize and fund the costs of OPWD's network of providers to comply with the minimum wage law. So another great inclusion in the enacted budget. The final budget also does include resources to continue to commit funds to develop affordable housing in the current fiscal year. OPWD will receive an additional $15 million in new capital funds to expand the availability of affordable housing opportunities that are reserved for people with developmental disabilities. The cumulative investment thus far has been about $95 million in capital funds to ensure the development of these safe and accessible residential opportunities. And these funds are in addition to the monies that are available or were made available a few years back as part of the governor's holistic supportive housing initiative known as ESHI, or the Empire State Supportive Housing Initiative. Those resources, unlike ours, support both capital and operating dollars. Ours are only capital. But we can, our providers can also look to competitively bid on ESHI funds as well to support additional residential opportunities for people with developmental disabilities. There are a few areas, though, that the budget is still, including some programmatic reforms that also look to generate some efficiencies. So in fiscal year 2022, OPWD will continue to seek and to leverage Medicaid funding, as appropriate, and take other actions to cost effectively provide person-centered supports and services. So a couple areas here. One is really OPWD is being asked to manage access to residential programs based on need. And to that end, OPWD will undertake a few initiatives to manage access to residential supports with the goal of ensuring that people live in settings that most appropriately align, with their overall need levels. So how will we do that? Well, first and foremost, OPWD will offer people who are seeking residential supports the most independent setting possible that can best meet their needs. In lieu of refilling vacant supervised IRA opportunities that become available throughout the year, we're going to look to assess individuals to determine if a less staff-intensive alternative would best meet their needs. And so, in lieu of automatic approval of a supervised IRA, there would be some expectation that we would look at supportive IRAs, family care opportunities, and/or rent subsidized apartments with wraparound community hab supports as potential alternatives. Again, just based on folks newly seeking residential supports in their assessed needs. Now, the savings here is relatively modest. I think we're looking at about $1 million in OPWD budget savings, this year. So if there are, if it does turn out that, supervised IRAs are the more appropriate level for people coming through the front door, then, that's something that we can manage, not a big dollar amount. The other area is really what we've been referring to here as the flow initiative. And really what that is asking us to do is to make opportunities in state-operated residential programs available to accommodate young adults who are currently living in inappropriate settings, such as residential schools. And in collaboration, so what does that really mean? Well, in collaboration with the person's care manager and circle of support, the proposal seeks to match people who currently reside in state programs with a nonprofit agency to deliver their residential supports. OPWD would really first look to assess those people who live in state-operated IRAs but receive their day programming from a nonprofit, and really that relationship would hopefully help, make it possible for a person to transition to a voluntary provider for their residential services. The ultimate goal here is that we would be making investments in the state and voluntary IRA system capacity and generate savings by reducing our spending on primarily on age-out populations who reside in and out-of-state residential school programs. Those services are not Medicaid funded, and so OPWD is liable for the full cost, the residential and day component, at 100% state share liability. And what we really are hoping to do here is to create some vacancies within the state sector that would allow state operations to receive individuals who are in these higher cost and inappropriate settings. We do expect to get some savings in the current year of around $8 million from this initiative. So it's a pretty big concept here for us to make sure that we can implement. The other area is that we're still looking at some state funding arrangements that we need to reform, and this will be the final area I think I'll talk about. And it really involves what's known as triple R money, and that's residential reserve for replacement. Typically, what this is it's in essence a per opportunity allowance, certified capacity, based on certified capacity that the state in essence gives consideration for for IRA providers. And it ranges anywhere, I think, from $600 to $1,400 per opportunity, depending on the geographic location of the provider in the program. And what we're trying to say now is we're, in lieu of allowing this kind of across the board, in essence, grant consideration, we're going to eliminate this RRR concept and just require providers go through a prior property approval process, which is in effect for, like, the acquisition of new programs, significant renovations. Typically, RRR monies are used for modest repairs and minor maintenance of homes. And what we're saying now is this is really a cash flow benefit to us. We realize that there's short-term savings and arguably, longer term, maybe, continuation of current cost structures. As we approve provider capital costs, they'll, get approved and paid, considered in our room and board calculation. But right now, the RRR money, it would be, the notion of RRR would sunset on July 1st, and we expect to get about $6 million in state savings from that activity. So that was a lot to digest. I think that's all I've got, though, right now. So in terms of major summaries for the budget, I'll pause there. Roger, others, if there are questions.
So I'd ask Nick and Michelle, do you want to ask questions, get clarifications?
I have a couple questions. Is that okay, Nick?
Go ahead, Michelle.
Okay. Kevin, both of the questions that I have really impact around self-direction. So in the initiative in regards to the COLA increases, should people using self-directed budgets expect to see some increase in their PRA to allow for that to be forward in self-direction? And the other is in relation to where self-direction might fit in with the housing alternatives and the strategies around housing. You mentioned, moving people from state op to nonprofits. We talked about maybe using supervised housing with wraparound services. Is there any thinking in terms of how non-certified settings with self-directed supports might fit into that strategy?
Sure. I think, self-direction, we kind of listed like I'll take the second question first, Michelle. Self-direction is definitely an option, right, for folks to pursue. We were just, discussing, the same kind of residential opportunities that people would have available. And we're talking about, looking at some alternative other than 24/7 staff intensive residential options. So yes, people can definitely self-direct. They can, self-direct and receive approval for rental subsidies. That's a longstanding practice that we've authorized. So I think that self-direction can tie in, within that initiative as well. With respect to the COLA, I think in the past, and I just need to confirm this, that we have extended the COLA increases to PRAs. I just need to double check to see whether that was factored in, but I believe that we have in the past, and therefore I wouldn't, suggest or imply that there'd be any different, approach.
It looks like Barb DeLong has a hand raised. It seems intentionally.
It was intentional. So thank you, Roger. Kevin, I have a couple questions as well. And correct me if I misunderstood, but one of the things you shared was that there's a planned general salary increase to state ops of 8%. Did you say 8%?
Oh, no.
Okay. Okay.
Yeah, no, that that would be a pretty big.
Okay.
Yeah, no, I don't. I'm sorry, Barb. I don't have a percent for that. I mean, typically there's like general salary movements of 2% and things like that. Typically, but that that actual percentage, I think, is still got to be determined and vetted based on contractual agreements. We had just deferred action on those, paying those increases. The question is, how far back do we go to authorize that deferral?
Okay, all right. That at least stopped me from hyperventilating. Because of course we know that the employees that are working for our nonprofits aren't making anywhere near the money that DSPs make in state. So that's my first question. The second question was about the flow initiative. And I understand, I do understand and the need to do this to decrease costs so that we can keep the cost inside New York State and then perhaps reinvest in our system, I hope. But if our main strategy currently to fill people that are living at home, to give them opportunities within the current framework of certified settings, I'm just talking about certified settings right now. And so people at home get an opportunity when they're priority one and when someone either passes away or moves out to a less restrictive setting. Understand the strategy you're doing there. But if that is the way in which we're filling opportunities within the state of people living at home, now we're going to kind of domino people from state ops that are familiar, that live in state run residences. We're going to put them into nonprofit residences. Those that are familiar with those folks because they're providing day services or whatever, get that. Then what strategy is going to be taken for people that live at home? Because you can't go at it. We already know we have a lot of people in need. So does that question make any sense at all? I was kind of rambling, but how do we do that? How do we make sure we're caring for the people that are living at home as well as the people that are coming in from out of state, understanding that that's 100% state funded?
Kevin, could I jump in here just for a second? So item 4 on the agenda, Barb, is going to be some of the more detailed housing strategies, and Abiba Kindo, who's our Deputy Commissioner for Regional Offices, will be able to kind of talk about it more from the program side. I would say from a budget perspective, the folks who would be subject to the flow initiative, that's additive. So what we're to the other opportunities that people may be able to occupy, be they people who are aging out while living in state, aging out, or simply, living at home and now needing that certified residential placement. So the budget modeling is that there would be savings associated with not spending money that's state-only dollars on that age-out population. But from a budget perspective, that does not it's additive, if that makes sense, to the opportunities that would be filled by others who would meet that prioritization. How it's going to work in practice, I think I would maybe defer it to the part of the agenda where we're talking more from a program perspective. Does that make sense?
Okay. Yep. I'll wait to hear that then. Thank you.
Okay, and John Maltby, it sounds like you have a question from a program operations perspective, but we're going to wait until we get to the Abiba section of the agenda for that.
Sounds good.
Nick or Michelle, or any other members of the DDAC?
I do have one more, and I'm having a hard time figuring out how to raise my hand, and you might want to defer this as well, but I just want to raise it here. Kevin, when you're talking about the federal, but the FMAP monies around home and community-based services, and you said that you're waiting for federal guidance. I know that money is tied to making improvements to home and community-based services. I'm assuming you're waiting for some guidance on what they're defining as improvements. But is there any, can you speak to that at all? I know that there is some framework as to what they're looking to be improved to get that FMAP money, how you understand that and how OPWD might be thinking about approaching it.
Kevin, why don't I take that one? So there was in the initial House bill in the American Rescue Plan, a list of a number of items that were permissible uses of the enhanced FMAP monies. In the final enacted version, which I believe was the U.S. Senate version, really what remained was this concept that the funds must supplement and not supplant otherwise state funding. We understand from conversations with CMS that us and every other state is having that guidance is expected. We think that some of the things that would be perhaps in the original House bill might be a guide as to what would be permissible uses. But I know that every state in the country is anxiously awaiting that guidance, because obviously, to the degree to which there may be exclusions for the use of the funding, you wouldn't want to commit money in that direction only to find out, that it's not, that it's not a permissible use. The other thing that's, I think, worth pointing out is it's a 10% enhancement in FMAP on HCBS expenditures in this fiscal year. It's April through the coming March. It happens to line up with New York State fiscal year. So we can project the value of that based upon expectations about how much HCBS services will happen this year, but we can't say exactly how much money it is. So in the enacted budget, there was an appropriation of $740 million, which is the authority to spend up to that amount of money, which is different from actual cash. So the other thing that we, in addition to how the money is to be used, the other thing we just don't know at this moment, and remember, the American Rescue Plan was enacted in mid-March, so it's not as if this has been around for a very long time. When will the state receive that money? And how does that relate then to when it can be spent? So if it's earned in this fiscal year, and then there's the claiming process that then leads to the receipt of those funds, we just don't have that guidance at this point, unless something happened this morning that I'm not aware of, as to when that money would be actually received, and therefore when can it be expended. So the budget has the authority to spend it when received for purposes that have yet to be defined by the federal government. So that's kind of where we are as of today. Does that help, Michelle?
Yes, it does. Thank you.
And then what we're going to be talking about next, and not to, is
Roger, if I'm trying to, I had my hand raised. It's done, right?
Oh, please go. Sorry, Donna. Sorry.
No. Can you see it? Because I'm just checking my technology here.
I can see it now that I've.
Oh, good. And I'm sorry to interrupt, but I actually wanted to say, I just wanted to take a deep breath, because really the fact that we got the American Rescue Act and the fact, thank you, Georgia, for the vote to the Senate. And, sometimes we sort of move forward, and a lot of advocates, advocating our federal level, part of this is unbelievable that we aren't where we thought we might be earlier in the year and last year. So I just want to take a moment to be grateful for the fact that we have the American Rescue Act and that the money is there. I'm really looking forward to some of the more innovative ideas that I think people want to put forward around whether it's under the 507 planning, the housing strategies, so I think we have some opportunity here, even with the one-shot 10% HCBS. So I think the moment is now. It's a pivot point. It's a great moment to sort of really, besides taking a deep breath, say this is a good time. COVID has been a real challenge for the people we serve and the people who serve them. So I just think it's just important to say that, because we had a budget. The governor's initial budget was really, we would be having a very different conversation at the DEC right now. So I just feel the need to say that. And I know we have a lot of work, and I'm really, I think we should get pretty creative now, because I think this is the moment in time where a lot of lessons learned from last year, that's for sure.
Well,
Roger,
Donna, it's always nice to pause on good news, isn't it? Right? Because certainly for those who had the budget briefing back in January, I don't think there was quite as many smiles as we're seeing right now. So I appreciate that note.
Roger, can you hear me?
Yes, I can.
This is Jerry. Oh, this is Jerry Athenas. I finally have some language here. I have a question. We seem to have a lot of crisis problems here on Long Island, and I was wondering where in this budget crisis intervention will be, because we have so many people that are hospitalized, people that during COVID had needed crisis intervention.
Kevin, would you like to address it, or would you like me to? I can do it either way.
Yeah, I mean, either way is fine. I mean, the budget does support, the START program, which I think has been a long, standing program. I believe there's, sites on Long Island, New York City.
Right, I'm on the board of START.
Yep. Okay, great.
I'm talking about people that are hospitalized, people that need a place to go, people that, we only have a couple of START beds that will certainly not be sufficient for those individuals on Long Island.
Yeah. So we, the way our budget tends to be constructed is around operating funds to support, Medicaid purposes, HCBS purposes. So there's certainly an opportunity, if that becomes the, the consensus as where, with appropriate offsets, to invest further in crisis and, invest less in some corresponding offset. One of the things that I know that we're looking at very closely when it comes to potential uses for the enhanced FMAP fund is the startup costs associated with crisis. So the operating costs would be associated with sort of ongoing Medicaid operating costs, but we do have certain regions in the state, I know not Long Island, but in certain regions where we don't have the CSIDD model implemented at this point. There were plans to implement it last year, and obviously COVID with many plans in the area. So, one potentially allowable use for the enhanced FMAP would be financing of startup costs for crisis intervention.
Oh, that's good, because we have one agency down here close their crisis house. So, I mean, we're constantly looking for crisis beds. Okay.
Yeah.
Thank you.
Yeah, and one of the challenges is with crisis, crisis opportunities is also making sure you have something for the person to do and go to, after the crisis, because crisis opportunities become sort of a permanent opportunity, and it's, not available for the next person who might be in crisis.
Yes.
I think that's something that can kind of fit within our overall housing strategies if we want to go that direction. And once again, that's part of the advisory council here. I'm hearing that suggestion and recommendation. Is there anything more on budget questions? If I've missed somebody's outraised hand, I'm going to scroll through.
Yes.
Yep.
It's Margaret Puddington. Hi. Kevin, you mentioned funds for new services. How much does that amount to? Is that the same 20 million we've been used to seeing?
Yeah.
That's one question. I have a second question too. Should I give you that at the same time?
Sure.
Okay. So I'm concerned about the proposed May 1st residential cuts. I know that's not part of the budget, but will we be able to use, for instance, the FMAP money or any other type of money to avoid those cuts?
Well, Margaret, let me take your first question. It's the $30 million kind of, state share tip is what we get every year, and that's what we have for new supports and services. So consistent for the last 8 years. And with respect to the, the 5-1 rate actions, I mean, I think just for a lot of folks who may not, be aware of it, right? This, we had to take action, back because we update our rates every 2 years to use more recent cost with our provider network in these IRAs and ICF and DAHAB programs. And, the update cost us $100 million. And that, that was not factored into the financial plan. And so we needed to look to ways to try to live within our, our current resource limit. This is all pre-COVID. This is nothing to do with COVID. And, as we, started talking to provider associations about that, we were clear about the need that we were able to get a pass and not implement retroactive rate cuts to 7/1/19, and that we were going to work with them and the Division of Budget to make sure that effective 7/1/20, we took action to, ensure that we had a viable financial plan, a viable budget going forward. COVID hits in the meantime, and, we had received a lot of feedback. I think at the time, we were talking about a potential for an across the board rate cut. I think people were concerned about, the machete approach to what we were doing. So we really started looking at other alternatives. And the alternative that we, looked at was really where we were, spending $300 million a year on what are in essence vacancies, vacant days that services aren't being directly delivered, whether they be a retainer day, which is where someone can be outside of the residence and and getting a Medicaid service, but the residential provider can still bill Medicaid for 100% of the rate. The other was a therapeutic leave day, which is basically a day that a person's out of residence all other times, but they're still actively, at some point receiving residential supports. And, the third area was this notion of an occupancy factor in the provider rates. The occupancy factor was in the supervised IRA program and the ICF programs. And what that was is that was really a payment for just unused capacity. And it was the lesser of 5% or the agency's true vacancy rate. So it varied across, the state, but on average is about 3.5% is what we were paying. So when you total all three of those up, we were paying close to $300 million bucks, a year in essence vacancies. And what the rate actions proposed to do effective 10/1/20 was to, eliminate the occupancy factor and to reduce payment for therapeutic leave day and retainer days to 50% of the established rate. So we're still making payments for those days. It's just at a lower level. And we also instituted a limit of 96 therapeutic leave days per person per rate year. And so what those actions were doing is effectively producing, offsetting savings that would allow us to keep the 7/1/19 rates permanent. And so, we were moving forward to implement those. They were approved by the federal government. However, with the onset of the pandemic, we look to sunset or at least delay implementation of those actions until a point later. So those rate actions now have been deferred until May 1st. Right now we are going to be trying to update those rates first for the 4/1/21 COLA, the 1% increase we talked about. And then, the health department and Deloitte will be calculating the subsequent rates for the 5/1 that remove the occupancy factor, which really is the only rate impact that the provider, that DOH and Deloitte need to do. So at this point, it's kind of hard to use, enhanced FMAP funds to cover, which are one time, to cover a recurring liability. And I think that is part of what we're looking at in this budget is to really look at that residential service, benefit and try to manage it and ensure that we have a sustainable system. We're going to continue to move forward with those 5/1, rate actions to implement them, given that, they were approved by the feds about 7 months ago now.
All right, I'm gonna try to move us along because we have several other agenda items, and I want to make sure that we don't spend the entirety of the meeting talking about the budget, but we wanted to start there because it lays the groundwork for the activities that we're going to be undertaking in the fiscal year to implement the budget. I just asked members of the panel to please, if you're not yet, thank you, everybody's muted if you're not speaking, so we create the least amount of interference on other people's lines. So we mentioned in the budget amendment, budget action, this enhanced FMAP. Something else that we are engaging in is a 507 planning process. 507 refers to that provision of the mental hygiene law that calls for an annual planning activity. We will be later this month engaging in some stakeholder engagement, opening up some regional forums. We'll get some information as those are mapped out about what exactly, who and how and where. And we're going to be combining that with engagement around the enhanced FMAP, right? So right now we don't know that what the permissible uses are, nor do we necessarily know exactly how much money will be coming to the state. But we do know that it's very, very important to engage our stakeholders, the stakeholders represented here at the DDAC, as well as a broader set of stakeholders throughout the state, to find out what are the most useful uses of this one-shot money. And when we say one-shot, it means it's an opportunity to invest, but if you invest in such a way that you create additional recurring costs that are not sustainable in year two, you build a program and then you don't have an idea of how you engage in operating costs in the year two. It's not the smartest of investments. Hoping that Mary Ellen Mosier has been able to join us. It's so difficult to see. Mary Ellen, are you with us? That may be a no, so I'll just speak. So what we're engaging then is what we're planning on doing is in the, as I said, it's probably late April, early May, we would be doing some regional forums. Unfortunately, of course, given the situation we're in, still with the pandemic, these will be, virtual opportunities to engage. We have a new email address, which is planning@opwdd.ny.gov. We'll be putting out information about that, and that will be a way for people who do not participate in the the forums to be able to share their ideas and thoughts. Assuming we do have guidance from CMS around the allowable uses of the fund, we would plan potentially to use a survey tool to gather, maybe some rank orderings of people's preferences. Once again, we anxiously await guidance from the feds on that to be able to have a relevant survey. So that's something we are doing. Our plan is to engage between sort of early May, late April, and early to mid-June. We have recently shared, I believe, as of Friday, with the counties in collaboration with the Office of Mental Health and OASIS, the annual county planning information. We also will be putting up on our website a number of items regarding planning materials, both data and information about sort of key current initiatives for feedback. And that's all planned within the next several weeks. Our goal would then be at the next DDAC meeting to be talking to you all about some of the things we've heard or more or less how the process is going, and also to be able to get your feedback. And then looking into the early fall, we would be composing the formal plan in collaboration with the DDAC. And that should key up for us by early mid-fall to be submitting that report, which would be containing, they're both sort of what are we doing now that meets people's needs and what are the areas for improvement, as well as set the stage for, thinking about what should and shouldn't be in next year's budget. So we wanted just to give folks that overview in terms of where we are on the 507 planning process. Obviously, a lot more to come as we get those pieces of guidance and that information put together. But wanted to put that out there. Nick, Michelle, I know this had been a particular concern to the DDAC to how to kind of sync up, our meetings, the 507 planning process. I know there's been a lot of stakeholders, in addition to the DDAC, that have wanted to see more direct and engaged 507 planning process. So make sure that everybody knew what we were up to and get the feedback on a process basis and obviously the substance to come. Michelle, others?
Roger, one question that I have, because one of the things that we've been talking about in terms of the DDAC is just the ability of the DDAC to have some meaningful participation in the initiatives and the planning for the initiatives prior to, you know, them really being solidified and moving too far forward. And, you know, you're mentioning, you know, that there's this plan for stakeholder forums, maybe rolling out later this month or soon thereafter, which and some outreach to the counties, you know, maybe to others. Is there an opportunity that if there was a small subset of people from the larger DDAC who wanted to have a meeting to be kind of informed of how you're planning on structuring those stakeholder forums, if there's some guiding questions that are going to be used, to have an opportunity to have some voice in that process for what that's going to look like before it actually rolls out and we're just reacting to the results that you obtain?
100%. Yeah, I think that's a great suggestion. And I think, you know, that may be a planning subcommittee, if you will, not to have subcommittees multiply, but I think that would make a lot of sense. You know, we do something similar with, you know, it's always good to know when you're asking people's opinions that you're doing it in a way that is thoughtful, culturally competent, clear, et cetera. So, we strive to do that. So I think that makes a ton of sense, and we'd welcome that. And we can certainly get the subject matter experts who are actually designing the process engaged with a relevant committee. So I'll look for maybe you guys to work with your committee to identify who the key players that you want to recommend for that.
That'd be great, Roger.
Okay. Anything else on the 507 planning process? Obviously, a lot more to come on the 507 plan. Okie dokie. So now I'm going to hopefully throw the mic over to Abiba Kindo, who is known to many of you, who is our Deputy Commissioner for Regional Offices. And the regional offices have a primary role in the implementation of our housing strategies. So the hope here was to talk about a few items of things that we are working on, sort of, you know, that as a consequence of the budget or as a consequence of trying to, you know, just better manage the housing resource generally, and then some information, and then hopefully an opportunity for dialogue. Now, Abiba, are you with us?
I am, Roger. Can you hear me?
Yes, thank you so much, Abiba. I will.
Thank you. Good afternoon, everyone. Hopefully everyone can hear me. So as Roger mentioned, OPWDD is in the process of reviewing our housing supports program and really seeking to enhance the housing supports program. I think it's important to clarify that when I talk about housing supports, we're speaking to the entire continuum of housing support programs under the OPWDD umbrella. I know that most folks tend to focus specifically on certified opportunities, but really wanting to highlight that there is a continuum of housing support programs that are crucial and critical in terms of addressing the needs of individuals who approach our delivery system looking for this particular support package. So we've been evaluating and assessing our capacity, our housing infrastructure, models of support, and our business processes around some of the housing program benefits, and really wanting to make sure that we are providing clarification where needed, and certainly working with some key stakeholders, you know, individuals and families, certainly care managers, and really making sure that folks have the information that they need so that when there is a need for housing, folks are well informed and can certainly work through that process as seamless as possible. I think it's important to highlight as well that we're really looking at how people access certified housing. It's really important that we make sure that that is a benefit that's available to folks who truly need that level of care. So looking at perhaps, the state approved assessment and how that can be utilized to better inform the different levels of care that people require, and making sure that the housing benefit is distributed equitably. Also looking at, as Kevin and Roger mentioned earlier on, some key initiatives, again, to better enhance the housing supports program. We mentioned the FLOW initiative, which obviously focuses on moving individuals from state operations into voluntary operated programs. And just to clarify, we're not moving folks. We are working with care managers and providers, making sure that a person-centered process is implemented to identify whether or not the opportunities in the voluntaries are an appropriate match for individuals, and to the extent that individuals and families are interested, that certainly would be made available to folks as an option. Barb, I think to clarify your point, the work that we continue to engage on via the CRO, the Certified Residential Opportunities Protocol, certainly with our housing subsidy, et cetera, that work continues. So to the extent that people living at home with their families meet the designation criteria, and again, we look at circumstances of the individual situation, that work continues. So there would be opportunities available to address that population as well. We're not just focusing specifically on the folks that need to move from state operations into the voluntary sector. We will be working with the CCOs and care managers, again, to make sure that through the life planning process, there can be proactive discussions about people's housing support needs, and then have those folks obviously engage with regional offices so that we can do a better job of supporting folks when the need arises, and being able to make sure that people have housing supports that they need. I think one other critical area that I want to mention is we will also be working with our voluntaries to create capacity to support high needs individuals. I think while we understand and recognize that we want to create that capacity on the state operated side, we do know that there are some voluntaries that have some really good strategies and training and engaging their direct support staff and curriculums that could be really applied here, so that we're going to be working with our voluntaries as well to be able to support individuals with high needs. So let me stop there and see if there are any specific questions or reaction to any of the updates that I shared.
Abiba, John Mulby, how are you?
Good, how are you, John?
Good, thanks. I wondered if you could touch on a couple of things. One would be any examination that you're making or made on how to increase the housing subsidy to bring it closer to the fair market rent. I mean, it's been unchanged for 9 years now, and on average across the state is about 26-27% below the HUD FMR. And I also wondered if you could, Kevin mentioned $15 million for ISH. The ISH program has been extraordinarily effective. Are there plans, and I recognize it's state dollars only, but are there plans to increase that? And I guess the last thing I would wonder is, given the aging of a lot of the facilities that are in both the state and voluntary sector, what encouragement are you giving to agencies to help them to ease the transition from larger settings to perhaps more accessible, up-to-date, smaller settings around the state?
So, John, very good points that you're raising. I think I'll start off first with the ISS subsidy. I know that that's been a long-standing issue that folks have raised and certainly brought to our attention, and that has been a part of our review, analysis, and assessment. You know, unfortunately, the increase to the subsidies were not included in the enacted budget, but I think that there's certainly something that we can look at, and I know that through the work that has been done through the residential subcommittee, I know that that's a recommendation that has been raised, and I just think that we need to look at other ways to be able to support those enhancements, recognizing that it wasn't included in this year's enacted budget. I'm not sure if Kevin is on and wants to contribute to that, or Roger.
I think you got it, Abiba.
Okay. And I think, John, the other point that you were speaking to was, related to the $15 million that's provided for capital as it relates to the integrated housing supports. We are in the process of doing an RFA short solicit interest providers who are certainly interested. I do agree with you that it's a very important part of the housing continuum and extremely effective, and certainly recognize the benefit there. So that's being our overall housing strategy as well, to really make sure that people are taking advantage of that as well.
And Abib, just if I could speak for a second, just for context, John, in terms of the budget development, when the budget for this year was developed, back in September, October, we were facing a situation where it was really about how deep do you cut, and where do you look for savings. It wasn't an inability to invest given the fiscal situation the state was facing. Obviously, there's been kind of relief to get us back to the stasis equilibrium, if you will, and then with the EF map, the opportunity to invest. I think that so the opportunities in terms of those enhanced recurring costs would have to occur as we look at unfortunately next year's budget. We already start looking at that now. I would say just one other point in terms of the transitions, with an aging housing stock, those could potentially be opportunities with an FMAP if what you're talking about is one-time investments to, say, transition from, larger homes. You're talking about a capital investment. The operating cost is sustained, for individuals, going just being served in a different place. So I think that's something that might be a place where an investment could be made if that was an idea that people think made sense, as we look about the potential uses of that one-shot funding.
Right, because we have several $1 billion worth of real estate. It would be nice to mobilize it.
Right, the real estate, which is not owned by the state, though it's owned, of course, by the provider entities. So that's that limits the strategies for mobilization, as it were. Other questions that folks may have on housing stuff? Leah Steinberg, I can see you.
This is Jerry again.
Hi, Jerry. And then
hi. I'd like to ask you, the state-approved assessment that you were talking about, are we moving away from the IM? What is that? You said, well, we'd have to use looking at certified housing through state-approved assessment. Do you have any other information about that?
So yeah, we're not moving away from the IM. The IM obviously is a tool utilized by the CCOs, and the CCOs certainly would be making decisions around the assessment tools that are utilized. So that I wasn't attempting to convey that at all.
Oh, okay.
Yeah, and what we're talking about is the use of the CAS to better inform housing needs, and as a way of understanding folks' needs as they present, for different types of supports, including housing. I think it's also important to note that IM is not a requirement of the state. So it's something that a care planning tool that the CCOs use, but it's not something that we mandate that they use. Okay. I'm going to get Leah Steinberg, who was trying to get in. Sorry. You're double muted, Leah. I'm sorry, we can't hear you.
Okay, you hear me now?
Perfect.
All right, so my question is, we're talking about housing strategies, and one area which I think, I don't know whether it's getting the attention it deserves or it should deserve, is the housing strategies for people who are outside of official housing in any which way, people who are home or in an apartment. because I believe that the supports that they're getting when they're not in official housing areas is not really being funded the way, the other housing is. Is there any, is that being looked into, or should we start looking into it? How does that go?
Leah, this is Abiba. Absolutely. And I think our housing strategy really looks at the continuum of housing and the housing benefit, really for anyone who's interested and eligible, depending on whether or not you're looking for a subsidy or if you're looking for certified housing. So again, I had mentioned early on that, working with care managers to make sure that there's some proactive planning that occurs around what one may need and when they may need it. So all of that is factored in, really making sure that we have a benefit that certainly can be sustainable, but can meet people's needs when they need it. So all of that is factored into the housing strategy that we're contemplating.
Yeah, but when you speak to when a person sits down at a meeting and discussing housing, so many of the I have to, through those discussions, that many of the needs that are real, somehow, well, this cannot be taken care of, and this issue is really not ours, but nonetheless, it is the issue of the person who needs the housing, and sometimes with a tweak here and a tweak there, a person could remain independent if, there was the funding for it. So how could that be addressed?
Completely understood. I mean, I think we have to look at, so there's one area where we're looking at the housing strategy, but there's another area where you're looking at the continuum of overall supports within our delivery system and how those supports can, better address the needs that individuals have. So I think, again, it sort of comes back to the proactive planning and being able to identify what supports folks need. I mean, if somebody needs additional hours of a particular service to be able to support those individuals within a particular home, there is a way to address that, right? We have a process to address that, and folks would be reaching out so that those discussions take place, so that if it's a couple of hours here or there, that can certainly be managed. I mean, we wouldn't want to be in a position where you're moving someone to certified level of care because you haven't really looked at, what are the support needs that someone requires and being able to authorize those services. But there's already a form and format for that to occur. So to the extent that there needs to be clarification or a better understanding by stakeholders of how to accomplish that, I think we certainly need to talk about that.
Okay. So how does that discussion happen?
So I think that the subcommittees could have those discussions, put forward some recommendations for us to consider.
Yeah, Abiba, I'm glad you bring that up, and Leah, thanks for that question, because I do think, housing should be, as you said, we've got a residential strategy or housing strategy. Is it a stakeholder-driven strategy? Is there a role for the residential subcommittee to participate in that? Because I think we have a lot of good skills in the residential subcommittee of the council that could participate in that. And as we know, they've identified a number of issues that exist that really haven't been addressed for the last several years, up to 10 years, that impact people's ability to choose alternative housing strategies.
Okay, I think one of the issues that I have found is that self-direct doesn't connect well to a lot of the, to a lot of the benefits that are out there, and somehow to put it together with the housing and the self-direct has to be addressed, because the self-direct area with housing is, I believe, a little weak.
So could I, Abiba, you're muted.
Can you hear me?
Yeah.
Sorry about that. Lee, I wasn't sure that I entirely understood your point about self-direction, and certainly, you know, we can talk offline about that because I do
Okay.
understand that. But, you know, Nick, I think to your point, you know, absolutely, again, you know, the purpose of this committee is really to put forward recommendations for us to consider. So to the extent that folks think that that's a priority area and want to further explore that and advance that for consideration, we're certainly open to that.
Yeah, it may be helpful, Abiba, for you to actually join the subcommittee. And again, as we get new members in that subcommittee, we can bring those new members up to speed on those recommendations that have been made, but also maybe help formulate some future recommendations.
Okay.
So I'm gonna, we have several members of the public, and we try to facilitate public comment as well through this, who've raised their hands. I'm going to try to accommodate a few people that way, and then I want us to talk a little bit about the last agenda item. Marcia Restivo.
I had raised my hand when I was having trouble logging in, so sorry about that.
No worries. That's the easiest comment to accommodate. You are now here. Thank you. Cindy Sloat.
Yes.
You
Am I
had
unmuted? Yeah, I didn't quite understand what you were saying about the children who are out of state right now. What the plan was for that? We're doing something special?
Yeah, so right now we have a number of people for who have aged out of their educational program and nevertheless remain at what is a school. And so there's consequence to the individuals in that that's not the appropriate place for a young adult to be living. There's consequence for the state budget in the sense that that's not something that the Medicaid program pays for. So OPWDD ends up paying 100% state dollars with no federal match. What we had proposed as part of this year's budget was a focused effort to look at those now young adults, to find appropriate opportunities. We have referred to it as the FLOW initiative, in that what we're trying to accomplish is many of those individuals remain as young adults at the school because they have challenging behaviors. They are more difficult to serve. And so what we are trying to do then is identify state-operated group homes that might be able to serve some of those individuals, and to the degree to which some individuals are currently being served in those state-operated group homes who might benefit from the less specialized expertise, who be able to move into homes operated by not-for-profits. We're creating flow in the system. We're creating an opportunity for those young adults to be in a more appropriate environment that can meet their needs, while at the same time achieving savings to the state by not spending money paying 100% state dollars. So it's a budget initiative and a programmatic initiative to achieve better results for the individuals, as well as meet our bottom line of a budget. So I hope that's clear, Cindy.
Yes, but is this going to apply going down the road as well? Like those that are right now going to be aging out, say next year?
Yeah, so we are also strengthening our efforts to not have more people enter into this situation. And so a piece of this effort is also trying to more timely, get people back, get people in appropriate supports, right? Because as from both a budget and a human perspective, if we save the money now and then immediately recreate the problem next year, it doesn't really accomplish the target. But so the answer to that is yes.
Okay. I know a lot of people in that situation who are asking me, and I'm like, I don't know. I know they're kind of towards the top of the list, but nothing ever happens. So.
Absolutely. Two more public members, and then we're going to flip it over to our next agenda item. I think it's Tamika Nurse Carter. We're getting a lot of feedback on your line. I'm sorry, Ms. Carter. We can't make out what's sorry. We're going to go to the next person Sarah Du Terroil. Sorry, I'm not getting your name pronounced correctly. Go ahead, Sarah.
Can you hear me? This is Sarah Du Terroil.
Yes, thank you.
Thank you very much. My only comment is in relation to the response to the question about crisis supports. As a parent of an adolescent who's been through the crisis support system in New York, there were two things that sprung to mind, and I feel that crisis support is going to be even more important moving forward if the idea is that individuals are going to move down the continuum of care to less supervised services. As that happens, the crisis response would need to be stacked up correspondingly to respond to the situation. So my first thing is, how is WDD working with OMH on crisis supports and services? When we were in the system, there wasn't sufficient cross-licensing of locations for children and adults in crisis, so that even though the agencies have pledged to work together, the reality on the ground was that if OPWDD did not license a site, then a child could not go there. And if it was well supported through the OMH side of things. So that's one of my questions. And the second one is, are the agencies working together to build best practices for crisis response? There are some incredible interventions through nonprofits and hospitals in the Buffalo area that I've put forward in the on the Medicaid side as a model for crisis interventions. And so I just wanted to get your feedback on that. And I am really concerned that crisis seems to be of a lesser priority in the budget discussion just now. Thank you.
Well, thank you for that. And a couple of things. First of all, I think in terms of the budget, we were talking about the things that were either funded or restored. I want to talk, and I can see Jill, I don't know, don't mean to put you on the spot, but Jill Pettinger, Deputy Commissioner for State Operations and Statewide Services, has been at the forefront of our efforts around crisis intervention development. Particularly, I know in the Buffalo area, there's the Baker Victory, or the Our Lady of Victory program that is serving children. So I don't know if you want to be able to speak to that for just a brief second, Jill, if you. You're muted again. You unmuted briefly and then now, okay. Yep.
Can you hear me?
Yep.
Okay, very good. Yeah, some of the issues that I was hearing referenced with regard to challenges with accessing cross-agency supports and services. We had done a lot of work with OMH to develop some pilot projects, and in fact, as Roger referenced, we had opened up a pilot project with OMH at Baker Victory, now known as Our Lady of Victory services in the Western New York region, really intended to address individuals who are duly diagnosed with a developmental disability and mental health, behavioral health diagnoses. And that program was able to successfully open back in 2018. So what we've been doing since then is really tracking and monitoring and making adjustments to that pilot program model together with our steering committee and OMH and with the program to make sure that we're troubleshooting, some of the real challenges that come with a program that is serving individuals who are duly diagnosed and where you have a lot of cross-system triage and coordination of services that needs to occur. So we've had some successes. We've had some cases that have proven very challenging. And what we continue to do is collaborate in our partnership with OMH to try to continue figuring out ways to be more proactive and to modify and adapt the program model going forward. We've had some discussions with OMH about potentially replicating this model in other parts of the state. We have another cross-systems meeting that is now convened regularly for the past year to year and a half with the Council on Children and Families and OMH, OCFS, OPWDD. And again, part of those discussions is really how do we best triage the challenges with individuals who have cross-systems needs. And again, we don't have all the solutions, but we continue to dialogue and a collaborative way to really figure out what are the most proactive strategies to continue trying to address and fill some of these important gaps in the system.
Thanks, Jill, and thanks for allowing me to put you on the spot like that. I want maybe, and Nick and Michelle, it sounds like we need to have some focus in future discussions with this committee about crisis from a number of areas, but we can maybe talk about how that should manifest. I do want to maybe move the agenda along to Diane Hank. I see. Hi, Diane. I believe we have a few slides. We're working quite diligently to make a much more explicit and intentional diversity, equity, and inclusion for OPWDD and for our field. We wanted to talk about some of the things that we are working on right now. We do believe there's a lot to be worked on here. And it sounds like we are getting up the PowerPoint, which, as I said, some slides. Diane,
Yes.
Let's see if we succeed.
Yes. Okay. Well, good afternoon, everyone. I'm going to advance through the first 7 slides because we're short on time and we want to hear from you as well as from me. So let me just jump to some of the core things that we wanted to share with you today, because I've been the Chief Diversity Officer for some time now at OPWDD, a role that I really embrace. And so today, what we wanted to do was give you a very high-level overview of things that we are working on within the agency and the field to give you a foundation, and hopefully we can move forward together from there. So there are 4 pathways, as I'll describe them, that I'm going to touch on very, very briefly. And I suspect in the future you'll want more information on these things and we can discuss them in further detail. But to begin, let me tell you a little bit about our own agency's diversity, equity, and inclusion strategic plan. Back in 2018, the governor issued an executive order in which he instructed all of his agencies on basic qualifications and things that we need to do to be a more diverse and inclusive state. And without reading through each one of these details, certainly this initiative affects not only internal OPWDD operations and processes and our own approach to diversity and inclusion, but also for our field as well. So we've been hard at work on a strategic plan that is just being finalized now to set forth goals for our agency and for our field. And I'll share a little bit about that, as well as we're also supporting the governor's recent announcement of increased language access policies. There's 4 more languages that have been added to the 6 that were already there. Now we're adding Arabic, Italian, Polish, and Yiddish to the 10 languages requiring translation. And we've engaged in implicit bias training for our leadership, are doing a lot more on communications initiatives, and we're also trying to focus on data because that's increasingly important as we try to make informed decisions. So here are the 4 major goal areas of our strategic plan, and I just want you to see that first is leadership, and as I mentioned, we are focusing on that on a number of levels within our upper and middle leadership levels at the agency and with the field. Secondly,
Diane, this is Michelle. Yes. If I could. This is the first that many of us are hearing about this. So you guys have been working on it for a little while, but please, if you feel free to slow down a little so that we really understand what you're talking about.
All right. Okay. Thank you, Michelle. And I talk very quickly anyway, and I know the clock is ticking, so thank you. I don't mean to rush the information. We could talk.
Can we clarify? Do we have a few extra minutes, Roger and Josie, just because the meeting actually didn't start until about 15 minutes late?
Yeah, we can go.
Because this is important and I don't want to rush through it.
Let's go to 115.
So. Thanks.
All right, very good. I'll take a deep breath. Thank you, Michelle. Secondly, the area is about our workforce within the agency, certainly, and there are recruitment and outreach goals that we have begun to embrace, tracking that we need to do. Again, we need a very data-informed approach. In our own agency, we also have to look at our workforce culture, what's really happening among our managers and our leaders and the direct support and clinical workforce, because these are all critical in terms of making an inclusive
place for our organizations to work and for our goals to be accomplished. Now, the last area, goal 4, is the one that's much broader, although the description here doesn't have a lot of detail. But this is the one where we begin to look at programs and services. And this is the one that expands it outside of OPWDD to our field. And let me go into a little bit about things we're doing related to the overall field as well. First off, we got a grant, and I have to tip my hat to the Developmental Disabilities Planning Council because they have really taken a leadership role for our state in a number of areas that I'll talk about. But one of them is allowing OPWDD to access grant funding for 2 years in order to look at our service access, particularly for Spanish-speaking and Chinese American populations. That does not mean that they're the only populations with which we're concerned, but these are the 2 largest language groups. And so based on some focus group work that had been done earlier, we decided within this grant to focus on that. So we are just finishing a contract. We did an RFP process. We're contracting with a minority women and business-owned entity who will help manage the process for us. And what we'll be doing very practically is looking at the following goals. We want to make sure that our materials related to the front door are culturally and linguistically competent. And that is more than just translation. Okay, translating is a base thing that we must do, and we try to already do based on our language access executive order. But there's more to being culturally competent, obviously, than just translation. Secondly, we want to learn how to increase access and information, not only to these communities through targeted informational campaigns, but we're hoping to also learn how to become a more culturally competent field. In other words, through this grant, the organizations that we've contracted with are going to help guide us in basically creating an operations model so that we can learn how to better engage with different cultural and linguistic groups. There's a lot of things we don't know, so there has to be some groundwork done to listen and to learn about how we can best engage with the different groups. So we're very excited. Over the next 2 years, you'll be hearing more about this. There'll be a lot of focus group work with community-based organizations. OPWDD is not taking any of the grant money within ourselves. All of the grant money will be expended in the field. And some of it will actually goes to community-based organizations who will actually be part of the process of the focus group and the data collection and the information gathering so that we can come up with some really good materials, a good model for the future. And what OPW will be doing is contributing staff resource time. So we'll work alongside the grant. We'll definitely be engaged with the grant, but all the money will go outside to the grant entity, the grant recipients and the contractors. So we're pretty excited about that. More to come. Also, our collaboration with stakeholders, which we hope is always a priority for us. We're trying to be very intentional now about collaborating with all of our stakeholder groups on the DEI process and progress. And that is in part the reason that we're talking today, is to make sure that we start to dialogue in every area, because as Michelle said, this is really important. And we've also just gotten some recommendations from the New York State Autism Spectrum Disorders Board, which we'll be integrating as well. Those are more field focused, but what they are overall encouraging us to do is make sure that we use a data informed approach and we really look at our service delivery system to make sure that our services are equitable. Another major project that is underway and has been for several years, also led by the Developmental Disabilities Planning Council, is a community of practice on cultural and linguistic competence in IDD. About 4 years ago, we applied, we meaning New York State, led by DDPC, to Georgetown University, which had some grant funding for 10 states to establish a community of practice. And so we applied and we did receive that grant. And this group of organizations that you see on the screen has been engaged and meeting regularly with each other and with Georgetown and with other stakeholders to look at our service system and determine what can we do within our own organizations and for our system to be more culturally competent and to learn how to strategize There's some excellent work that's been going on through this community of practice. And now the grant, I think we're in year 4, it's a 5-year grant. We're looking at how we can expand to include other stakeholders within this community of practice. We're not sure what that's going to look like. One of the main things that we're going to do to kick this off and start to engage outside is this group is willing to offer trainings on different topics, the members from representing these organizations, but they're also planning a DEI summit, basically a transformation summit with a focus on diversity, equity, and inclusion that's going to be in September. So that'll be a virtual summit, and you'll hear more information about that. We'll certainly bring that back to you. Within the community of practice, they also did some really good focus group work several years ago, and I won't read all of these quotes to you for lack of time, but what they did was basically go out and engage with community groups, primarily Spanish and Chinese speaking or Mandarin or Cantonese speaking groups, to learn about what are the issues within your communities. And you can see from the comments on the screen, these were commonly heard. And there's a photo on one of the screen, on the upper left of the screen of a forum that was done. I believe that was with Korean speaking families down in the city, but where we went out and we listened. And then the community of practice group also did very focused groups where they sat, listened, and they compiled a report, which is available on the DDPC website. I should have included a link to that, but if anyone's interested, you can email me and I'll be happy to give you that link. Basically, there were 3 needs identified, 3 top needs. They wanted more engagement with people with limited English proficiency. They wanted more resources really at the basic level. They found that for the communities where English was not the primary language for people, the resources were just not simple enough, and they wanted more. And they really wanted to address the language access barriers that relate not only to learning about our system, but engaging with our system, not only at the front door, but also at the service coordination and the service delivery level. And some of those quotes that were on the previous screen reference that people want to be understood and they want to understand. And there are some limitations in our system right now that we need to look at, and we will. All right, another big initiative that has been going on this is the 2nd year, also spearheaded by funding that was allocated through the Developmental Disabilities Planning Council, went to establishing something that's called the Ramirez June Initiative. What they've done is they partnered with the New York State Office for New Americans, which is a state agency that exists, established by Governor Cuomo. And what they did was fund we call an Idd Navigator. It's the first initiative of this kind in the nation. And basically, this person who got hired full-time to work within the Office of New Americans under this grant funding has been working to strengthen the network that reaches out to new Americans. There are community organizations all across the state that they coordinate with. And this person has been networking, linking with these groups, and bringing information about our system, sometimes about the entire healthcare system, to groups around the state and trying to build that with the goal that once this network is built, that it will strengthen and will continue to foster this. So this one was very innovative, and Cynthia Stewart is the Idd Navigator for this, does a lot of speaking. If anyone's interested in more of that, I can certainly connect you with Cynthia, because that's her role, is she goes out and she makes connections for people about the real needs that they're experiencing. All right, I know I did go quickly. I skipped over the basic sort of definitive information on DE&I and what it is, because I knew we wanted to allow time for conversation. You'll see that at the bottom of the screen, there's an email address that we have established at OPW that's dedicated to all issues related to DE&I. And so if there are specific questions related to anything on DE&I, you certainly can email us and we will respond to you. I think the biggest thing I want to say again before I hand it back to Roger and allow for your commentary is we could talk all day about this. This affects every part of our system. It affects all of us. And what we're trying to do now is be much more strategic in our intention, in our data collection, and our focus to look at our system and say, how equitable are we? And who are we reaching and who are we not reaching? And what does our service system look like? So I'm going to stop, take another deep breath. And Roger, I'll hand it back to you. And I welcome any questions related to what I just shared.
Thank you. And I would just emphasize, we are increasingly looking at what are the outcome measures where, you know, there's intention, there's outreach, there's engagement, and then there's actually saying who's receiving services, who's not receiving services, and how does that relate to the diversity of our state. So it's very much shifting our focus to kind of an outcome-based measurement when it comes to that. And, you know, we certainly need to be much more equitable in the way the service system meets the needs of New Yorkers. So let me ask if there are any questions that folks may have at this point.
Yes, I would like to make a comment more than a question. Can you hear me?
Yes, I can. Could you, it sounds like Valeria Valdez, yes? And I think LaWanna Jones, you also had your hand up. We'll go with you next. Please.
Okay, I as a minority and a parent of a child who have a developmental disability, I really appreciate all the effort that have been made in order to facilitate the access to the existing services to my community. And I would also we like to see it more realistic effort in order to make it more easier to my community to access the existing service. I remember when I started working to parent on New York State, the organization basically create a new position that was overseen by me. And it was more about to facilitate the community information in our native language, and that information was more easy for them to access because it was coming in our native language. So we really need more people, more Spanish speaking in the field, just to benefit the individual who receives service, and to make it more easy for them to understand how the services work. And as Diane mentioned, the language barrier is the biggest barrier in order to access those existing services. I'm so happy again to hear, all of the efforts that have been made to make it more meaningful for the community to get in the services that are there. Thank you.
Thank you. I think LaWanna Jones, you had your hand up. Am I right? You're muted still. I'm sorry.
Okay, thank you. Thank you. Thank you. I appreciate all the work, Diane, that you've done as part of your efforts. I would also like to say that I would like to see increased efforts to reach those African American families who have not been able to receive services equitably. Not really certain how you are also planning to address those families. As we know, there's issues around systemic racism that impact the ability for our African American families to receive services. And so would like to see a little bit more also included, not just for Chinese and Spanish families, but also for African American families also. Thank you.
Yeah, and I think we would appreciate any specific recommendations. I know that, one of the things that not mentioned in this presentation, but that has been a strategy, is there are certain provider agencies that have had a multicultural focus and have been focused on certain communities. I know some of them have been struggling recently with with pandemic-related expenses. So one of the things we're interested in to connect pieces of the conversation is, as we look to potential one-time investments of the enhanced FMAP funds, are there initiatives, are there investments that can be made that could be enhancing the equity of the system? So are there particular communities, are there particular targeted investments? Because I think where we're feeling is that there's a lot of intention, but it's between the attention and the action that we need the more concrete ideas. I'm looking in the chat room. There's a long, sorry, I'm just trying to see who, which. Okay, is there anybody else? I'm trying to navigate 3 screens who has their hand.
So it's Jerry again. It's Jerry Athenas again. I just wanted to say that thank you, but the DDPC in the past has given a grant to Prideability and Free to Be, and those that LGBTQ program is exploding across the state of New York. We have monthly meetings, 2 meetings a month. We are now going on some of the CCO websites so individuals that need to want to get together and want to meet other people will be able to do that. And that all stems from the grant from the DDPC. So all of this programming that we've just viewed may have an impact on what's going to happen in the state. So the more we open up, the more we give out information, the better it is for all of our individuals. But I just wanted to let you know that Prideability program, we really are expanding and doing quite well. And hopefully when we'll have get-togethers again and people will be able to actually see one another in person, it'll be even better.
Yes, human contact would be so lovely. Robert Pitkovsky, it looks like you are trying to get a word in.
Yes. First of all, Diane, I'm really impressed by this effort. My question is, I guess, how to continue to build. Down here in the Lower Hudson Valley, focusing on our Haitian Creole community and our Yiddish-speaking Jewish communities as well. These are, there's high need, I think, in these communities. I was just wondering, in terms of rolling out, obviously, I know that some of this is supported by grants. And so obviously that you may be limited in that way, but I just wanted to sort of put those up on, as additional places to focus, future outreach activities. And I do agree with the focus on the 101, how to get to the front door and then how to navigate as well. I think that's a really important focus.
Thank you for those thoughts, Robert, and all of them actually. If you, as I said in the presentation, please email me with any other thoughts you have, because your question is the one that I think we are working on right now is the how. For the beginning, because it's expensive and we don't want to leave anyone out, and we don't. That's the whole purpose of all this. So I believe there will be, well, at least we intend to do a lot more dialogue with providers and community groups to begin to establish it. It's not just one entity, but we're trying to build some partnerships, again, with DDPC and with the community of practice and other providers. So I think there's a lot more to come. So your comments are very important, and I want to make sure we don't lose track of those, because it's a conversation that our whole state really needs to have, and we have to do it at multiple levels. And we know that, which is what I wanted to tell you is I hear you, and we're very aware, which is why Roger first wanted this presentation. And when he first asked me to put together the info, I said, can I have 50 minutes for the presentation and then discussion? And he very, very astutely said, no, you can't, but he appreciated the effort. So, because there's so much to talk about is the bottom line. So thank you for your comment.
Of course.
I do want to say, to go back to something, Luana Jones, that you mentioned in terms of thinking about systemic racism and thinking about it within our system. It's not just engagement with communities that may be underserved. We're also taking a very hard look at internal business processes. Are we fairly allocating resources in a way that looks at people's needs? So we mentioned earlier what was presented as a budget initiative around accessing housing supports with regard to people's needs. As opposed to maybe demands, or who made the, who complained the most loudly and therefore they can access the service first. If you take seriously the effort, a fair amount of examination internally within OPWDD, how have the systems that we have put in place over many years for allocation of resources, review of people's service needs. We mentioned previously, but not in this meeting, that we have an effort to look at community habilitation, service access management. When we looked at it, not necessarily through a racial equity lens, but through an equity lens, more generically, we found variances between regions between 25 and 50% based upon the same fact pattern, because people were just making different decisions. Now, how does that translate into decisions based upon race or gender or ethnicity or religion or sexual orientation or so on? I don't think we have that information yet, but if you take seriously the idea of combating systemic racism, you really have to embrace looking at your own internal processes, the ones that may feel very, very comfortable, and querying them. So what we're doing internally as well is really taking a very thorough look at how we make decisions and where do those decisions need to be made more thoughtful. And I'll just connect another dot. One of the reasons we felt it was really important when we're talking about the investment of the FMAP monies to engage in an explicit stakeholder process. Once again, hopefully engaging fully our various communities, and I like the idea of DTAC helping us make sure we do that, right? That we get as thorough an engagement so that we use that money in a way that actually serves all of the communities we serve, and not just those who maybe often have a voice in the discussion. So it really is connected to everything we do. It's not a side project. It is a fundamental value of how we're trying to move the system forward.
Roger, it's Nick. One other thing that I would just suggest to Diane and you is that as you look at how do we develop the strategy to improve diversity, equity, inclusion, we have to kind of look at those other resources that tend to be referral sources for people from OPWDD, everything from early intervention to the school districts and whether or not people are actually getting health services, because ultimately, even in the medical services, are they being told about OPWDD, and how do we get started from that end?
Yeah, I mean, and the areas where at least where we have begun but not ended the examination is saying, we spend, what was it, Kevin started with over $4 billion of state, monies. We better make sure we're doing that in an equitable way, right? And then you kind of track it back. The more you get into, say, early intervention, that's something we have an interest in, right? But it is not an area that OPWDD, funds or regulates. So we can have opinions, but it's not our program. But you're right. It's querying deep into the continuum. I wanted to flip over. There's one person who's been waiting patiently with a hand up in the public comment section, who's Lynn Decker. So I'd like to give an opportunity for Lynn Decker to voice the opinion, ask the question, et cetera.
Okay. I just wanted, I had a question for Diane, very specifically about language translations and the additional 4 languages. Were those added to match languages that DOH has on its list? Were those added based on early estimates of what the 2020 census tells us about New York? And if you can send to the group at some point a list of what the prior languages are for reference.
Oh, definitely. We can do that. This was an announcement that was very, very recent by the governor, adding these extra languages. So there is a link to an announcement that I will get to Josie, and she can forward it along with the PowerPoint slides to you. So yeah, no problem there.
Thank you.
I wanted to make one more point, then throw it back to Nick and Michelle for any closing remarks. And just connecting one more dot. One of the things, for those of you who have been attending DDAC meetings previously, there's a lot of new members. We've worked very hard to expand the diversity, both geographic, racial, ethnic, linguistic, life situation. We're trying very, very hard to make our advisory groups representative of the diversity of this state. And that's obviously not a one-time effort, but an ongoing challenge. So I'm extraordinarily happy that, we're moving, in my mind, in the right direction. And with that, I would say I will give Michelle and Nick an opportunity for any last words as chair and vice chair, respectively.
Michelle, you're on mute.
If we have just a couple more seconds, it looks like we have 6 more minutes. I see that Kai has had her hand up and she hasn't been able to speak yet in the meeting, so I'd like to hear from her.
I am so sorry, Kai. Thank you very much, Michelle.
No, that's quite all right. Luana and Robert actually touched on what I was going to ask, and as far as more urban outreach. And part of the problem is that people don't know that they don't know. And how do we reach those people, especially out here in the urban areas? I'm in the Bronx. A lot of people don't know. I deal with families and I deal with group homes. And sometimes they're just not, as far as the families are concerned, they're not aware that there are programs and services available to them. And I point them towards, well, no pun intended, but I point them towards the front door. As far as the group homes are concerned, there are a lot of things that are going on in the group homes that are of concern to me. As a parent, of a 19-year-old who, once I leave this earth, he's going to be under the care of his sister, who already told me she's going to put him in a group home. So things like that need to be looked into as far as what is actually going on in the group homes. And I know that might fall under diversity, equity, inclusion, what Diane was talking about as far as she mentioned something along the workplace culture. That falls under that. It really needs to be addressed. Me personally, on the front line seeing it, that is something that really concerns me.
And thank you. I wanted to mention, we also have an emerging community practice with our providers. We've been, so depending upon the group home, whether you're talking about, obviously we can more directly impact state operated group homes and hopefully the culture that occurs there, and then also working. And I know that for a number of our provider organizations, they have key strategic priority around improvements in the areas of DEI. And so I think that, once again, depending upon, who's operating that group home. Nick or Michelle?
I would just end the meeting by, again, saying how excited we are to have a new group of members, all the recent additions to the DDAC. As you can tell, just in the couple of discussions that we have had between the 507, housing, diversity, equity, inclusion, many of these topics are fairly deep and require significant discussion and engagement of the DDAC. So this is why we need to make sure that we send out the list of the subcommittees, that we correctly define what those subcommittees are focused on, because again, a couple of these topics have not been on the radar screen of those subcommittees. So we need to be able to make sure that we prioritize what the subcommittees spend their time on. And I think what's most important is that we have the ability to engage with OPWDD on these topics to provide input. I think the current membership of the DDAC shows that we have quite a bit of diverse thought, diverse representation from the state, diversity within the membership itself. And I think that will only make us a more effective body to advise OPWDD. So we have a lot of work to do. And again, I think much of that work is going to need to be done at the committee level, but also with the engagement of OPWDD staff. So thank you for signing up for this opportunity.
Okay, well, I think it's usually called my opportunity to say thank you to everyone. Wish everybody a wonderful rest of your day. Thank you to those of us who were able to participate today, and take good care. Bye-bye.
Bye, everyone. Thank you.
Yeah.